I'm Catel Le Goulven, and this is Mission to Change, the show where I hear from people who turn business into a force for good and learn about their journey to make it happen.
I think I'm getting wiser. I think I'm getting wiser because of that.
Today, I meet with Dr. Rasha Rady, the co-founder of Chefaa, a tech-enabled healthcare platform facilitating access to medication in Egypt. Rasha is on a mission to improve health in the Middle East and North Africa.
Hello, I'm Dr. Rasha Rady. I'm the co-founder and COO of Chefaa. I had this silly dream of Chefaa being a verb in the future where it can be used by all chronic patients when they want to say that I'm compliant to my treatment and get my medication regularly. He would say I'm Chefaa-ing it.
Non-communicable diseases, also known as NCDs, are chronic illnesses which are not passed from one person to another. Like, for instance, heart attacks, cancers, chronic respiratory conditions, or diabetes. These diseases account for 70% of all deaths globally. And in Egypt, the Arabs' world's most populous nation, they account for 82% of all deaths and a 12% loss in GDP. Rasha has devoted her career to those patients affected by NCDs and to children, most specifically. She is a pediatric doctor at the Cairo University Children's Hospital. But becoming a doctor was not what she originally wanted to do.
My number one choice was going to the AUC, the American University in Cairo, to study computer science.
So why did you want to do computer science?
It's silly, actually, but at that time I used to read stories called ملف المستقبل. These are stories for young kids, and there was this key character. She was a computer science woman, was very good, yeah. And I looked up to this character. Actually, I wanted to be as good. Her name was Salwa, and she could make any computer system obedient to her talents. And I always wanted to be as good as Salwa. So, but my parents were like, "You have great grades. You can go to any college. You have skills that actually fit with a medical career. Why go and try something else because of a fictional character?" I know I have the skills, but I wanted to try this one other thing. And this is a big decision to be made on a fictional character. So they are right somehow. And so I went for the Faculty of Medicine. Apparently they were right. I do have the skills.
This is how Rasha became Dr. Rady, now practicing pediatric hematology and dealing with complex procedures, such as bone marrow transplants to cure children from the deadly chronic conditions. How do you feel about helping people and saving lives as a doctor today?
I will not sugarcoat this, but it's really a huge burden that's growing every year, because the more time you spend doing this, the more experience you get. So naturally, you're supposed to be better. So more patients trust you. So you will see more than you saw the 1 year earlier. It's not going to get easier. People think that because we do not express everything that we feel, because we need to look strong all the time, we are the ones comforting the patient, that we don't feel. We feel everything, we just don't show it, and that's getting more difficult every year.
During her 10 years of practice, Rasha has seen a growing number of patients. And with this, she increasingly sees the pain point of scaling her impact.
I've seen so many chronic patients and their parents, of course, because since my patient are usually kids. I've seen the impact of chronic illness. And throughout these years, I've been thinking of some other way to help other than just simply seeing them in my clinic, prescribing medication, and following them up. What's the point of seeing the patient, examining them, prescribing the medication, and then tell him that I need to see him in the coming month, for example, for follow up, if he doesn't get the medication I prescribed for him? And this happens a lot. I have this patient who lives in Siwa, Oasis, that's 3 days away from Cairo. So he travels from Siwa to come to Cairo for his monthly follow up. He has three girls, three daughters with the same illness. And if he misses the bus, he gets late. If he comes late to the hospital, he missed the pharmacy and he cannot get his medication. And that's all after traveling for 3 days. So you imagine that we have to plan ahead for so many things. You have to have a system that bypasses all the shortages.
Medication shortages are common for chronically ill patients in Egypt. With 2 million prescriptions to fill each month, shortages can set back recovery or be deadly in extreme cases. The inability to help became a burden to Rasha, who then went on a mission to change the system so that the problem of accessing medication that reached far beyond her role as a pediatrician could be fixed. She started from where she was, a hospital in the Egyptian governmental healthcare system, and from what she knew.
At the beginning, back in 2015, I thought maybe I need to change something in the system, the healthcare system. So naturally, since I'm very good academically, I decided to study something else. And I studied healthcare quality management, patient safety. So, and I got a professional diploma for that because I thought that the answer is working on improving the quality of healthcare and patient safety. But it it's really it's not just that. You need to find a practical way that tackles the problem directly, and you need to motivate all stakeholders to work with you on that.
How did you try there, and what did you do to try?
Well, with all of the knowledge I got, I tried to put a new system to uh, help everyone in the system to be involved in solving the problem. But there was some resistance. First of all, the healthcare personnel involved in the clinics or the hospital, when I told them that we need to organize things and this is how we want to do this, so that process is much easier and safer to the patient, so that we can plan ahead any shortages. So to them, they can only see it as an extra work that they will not be paid for. So eventually, you still get the same problem hit in your face every time.
It was back in 2017 when her close friend Doha Aref undertook a treatment for thyroid cancer that Rasha started to look at the problem differently and envision other possible solutions.
I have to be honest about this. I couldn't find the right solution or how to do it until I joined forces with my co-founder Dua. And that only happened after she was diagnosed with thyroid cancer. And the surprise was that surgery was the easy part. The problem was for her to get her daily lifelong meds regularly afterward. I remember her calling me on the phone during her isolation. She was isolated to receive her radioiodotherapy. And during her isolation, she only had her mobile phone and her laptop. So she called me and said, I can literally order anything I want except for the medicine I'm going to need for the rest of my life. I'm a doctor. I have some connections with more than one pharmacy. So, on a personal level, we can bypass this problem and solve it for you. But then she said, okay, thank you. You will help me. But what about others? So naturally I said I cannot I cannot help everyone.
Let's explore the problem faced by a patient who has a prescription and is trying to get medication. Her access problem could have several dimensions. Pharmacies may be out of medicine, or she might not know which pharmacy would be stocked, or medicine might be too expensive or not covered by health insurance. In Egypt, a large percentage of the population does not have health insurance. This is how this problem looks like in practice.
Let's go through the actual scenario. Right now, I have a prescription that I've went to the nearest pharmacy and they said they do not have the medication. So I will go on foot to the next pharmacy and do the same thing again and again and again. And then after the fifth pharmacy on my way that says, no, I don't have it, I will probably do what everyone else does, which is writing a post on Facebook saying, I'm looking for this medication. Can someone help me? And then my friends from around Cairo, for example, would say, "Yeah, I think the pharmacy down the block can do that, but this pharmacy is actually, in another city, so they cannot deliver. So I have to go there." And so on, which is very hectic actually, and very stressful, especially if you're sick or your loved one is sick.
So in April 2017, Rasha and Doha organized focus groups to design and test another scenario.
What if we create this network of pharmacies where you send a prescription and it automatically goes to the nearest pharmacy as per the GPS? The pharmacy on the other side is empowered. They will either say I have it or not. If they have it, they accept, prepare, and deliver. If not, they will cancel from their side. In such case, instead of the patient reordering, it is automatically forwarded to the next pharmacy, and so on until a pharmacy accepts, prepare, and deliver. This will save time, it will save effort, and it will give the pharmacies access to a bigger customer base. So on the other side, pharmacies have more sales. So it's a win-win situation.
Originally, they targeted the elderly, a large population affected by NCDs and suffering the most from access to medication challenges. This is also a population who is not very tech savvy. So if the app worked for them, it would work for everyone. But they soon realized that they needed to expand their offering.
Our thought or our idea was this will help chronic patients, especially elderly. So we needed to be very easy, easier than Uber. So we would offer the app to patients who are more than 60 years old, who did not use Uber, and would give them to try it. And we would say it's very easy. But throughout the days and the month, we discovered that most of chronic patients who are more than 65 years old are taken care of by their kids, or their grandkids. So we need to direct our message to those, not to the elderly.
The creation of Chefaa was not successful on the first try. Their application to a local incubator failed because the focus was unclear.
I think that was why we were not accepted, because it reflected how confused we are, and we are not really set on how we're going to do things. So that did not have a very good impression. I think the lesson learned at that moment was that before going into a new step, you need to know why you're doing this, how you're doing this, and you need to be honest about it. Failing is not good, but it means that you have tried something. And usually it's the lesson that you learn from failing that you use to succeed the next step. So it's all about learning, continuous learning, which is the skill that I know best.
Out of this failure, Chefaa, the app, connecting patients to pharmacies for safe, easy, and fast access to medication was born. A first prototype was developed and tested with patients and pharmacists.
We did some focus groups. So we have this scenario, and we actually went and stood outside of a pharmacy. And before the patient goes inside the pharmacy, we would give them the app. I would tell them, uh, before going inside the pharmacy, what if you order your prescription through this app? And he goes through the interface and says it's very easy, but will it work? So we went to the pharmacist, and we showed them their app, and they start giving us feedback, what they expect, what not to expect, how it's going to be easier for them to communicate or interact with the application. And then that's how we came up with our first version ever of Chefaa. And we have been working on improving the apps since then. We now have more than 20 releases, actually.
Rasha and Doha kept on growing thereafter.
Since inception, we now have partnered with more than 800 pharmacies. We have fulfilled more than 1 million order. We have now more than 1.8 million monthly triggered users across all our platform, and that's since inception. Throughout the year of 2020, especially with the COVID-19, we have responded to more than 1 million pharmaceutical consultation. We have 24/7 support managed by licensed pharmacists offering free pharmaceutical consultations. This is a cloud service, so it's not limited to Egypt. And the top 5 countries have been using this has been Egypt, KSA, UAE, Kuwait, and Iraq. And more than 15 Arabic-speaking country has been using this service, together with the dosage reminders throughout the year 2020.
This is impressive, and Rasha acknowledges that COVID helped their efforts.
The COVID has forced so many to understand that getting your service online actually works, and it can be safe. Before the COVID, especially here in Egypt, it people are not really familiar with the online shopping. But after COVID, the online shopping in general, not just the prescription medicine, has increased more than 940%. And people before the COVID were not really into online payment. Only estimated from 4 to 6% of the Egyptian population go for online payment. After the COVID, this has increased like 2 or 3 times. So I have to admit, the new normal caused by COVID has added some awareness, and people are now more open and ready to try things. And they only need to have enough knowledge on how to decide what's good for them.
The role of Rasha is key here. She is the Chief Operations Officer, and the growth of operations is directly connected to her ability to tailor services to the evolving needs of Chefaa's customers.
The real challenges are every step of the way you need to educate your audience. First, you have to tell them that I know your problem. You have to articulate the problem. And once they feel that you know how they're feeling, they will listen. And that's the key. If they start listening, you'll be able to tell them all about your service and how it can be good. That's the first step. Then when they first try it, we always get feedback. Because of my doctor and my background, I understand where that feedback comes from. So I can assess whether it's really something that needs to be addressed, or it's a luxury, a matter of luxuries that can be put aside for now and then addressed later.
If the first big scaling challenge faced by Rasha and her team is to educate and empower Chefaa's customers, another one, more classic for entrepreneurs, is to find investors. And on this front, Chefaa has also been pretty successful.
We have raised our pre-seed fund from the accelerator Flastex Labs, And then we have raised in 2019 our seed round. Amid the COVID-19, we have raised our pre-Series A round. And we are looking forward to raise our Series A. Our next round will be Series A.
Looking ahead, Rasha and her co-founder Doha have plans to automate and expand their services beyond Egypt, starting with the Kingdom of Saudi Arabia as the next stop.
I start from Egypt. I improve and enhance, make my foot solid ground, and then I go to the next country, and so on and so on.
Rasha's medical background and expertise are essential to grow Chefaa. And on the other hand, the entrepreneurial savviness she gained through Chefaa is serving the system change she has been trying to drive in the healthcare system in Egypt.
Well, I'm assigned member of the Quality and Accreditation Unit at Cairo University Children's Hospital. So we are now more focused on improving the healthcare quality management in the hospital and patient safety. So that before Chefaa, I would go by the book. So people will not really like me.
What do you mean you go by the book? How can people not like you?
Because I'm very strict. I wasn't that flexible. I know when there's a dead end and that you need to find a way around it. And that happens a lot with quality management because most of the times you are dealing with human behavior that needs to be changed. And yeah, so working is creating a system that works, that actually works. It requires a lot of resilience, flexibility, and focus. And Chefaa has taught me most of that.
Do you feel that you have more impact on more lives now than you had when you were a doctor?
Yes, it can do this in numbers. If I can physically, I can see from 25 to 50 patients a day. Now, through Chefaa, I'm actually helping much, much more. I'm talking about more than 1.8 million patients empowered, knowing about their medication, asking pharmacists, getting their medication, bypassing shortages. So the difference is huge.
Do you think that social problems require business solutions?
Personally, yes. When you try to find a solution and you go through a solution that is not business-like, that does not generate revenue, you'll always try to find a way to make it sustainable. And if you don't make it sustainable, this is not a real solution. It will just cease existing. Now, you have two ways. Either you generate revenue, and these revenues will be used to make it sustainable, or you find a way to raise donations, funds, crowdfunding. But in such case, every time you are depending on raising donations. Personally, I don't see that this is sustainable because people who donate money have so many problems in the world that they need to donate to.
Becoming an entrepreneur took Rasha's impact to the next level. It also changed her perspective and her personality. She told me she became more flexible, more productive, but mostly she learned to try.
I learned to try. Before Chefaa, actually, there was no such thing as A/B testing. In my career, to try something, a patient might die. So you do not try something. This is not something that we do. Trials have regulations and way to do it. So, but after Chefaa, trying new things with the possibility of not working out from the beginning is something new that I've learned and has introduced me to so many lessons that I learned in my life.
And out of this learning comes an important lesson for aspiring entrepreneurs?
Well, entrepreneurs, if you're coming from a background that's not business, just like mine, you have to look at it as a new language. This is a new language that you're learning. That's one thing. Another advice I always remind myself of is focus on the problem, not on the solution. Because at a certain moment, you might find that the solution you're using or you're building is not really working. But that doesn't mean that you need to stop. It just means that you need to change the solution. You need to pivot in order to solve the problem. If you fall in love with the solution, you will not be able to pivot. You probably will fail, give up altogether. But if you fall in love with the problem, you will easily find a way around it, even if that means building a totally new solution.
Mission to Change is a podcast by the INSEAD Hoffman Global Institute for Business and Society in collaboration with Intent. It's created and produced by Human Humans. The original music, sound design, and mixing is by Palomino. And special thanks go to Cody Gildert and Maria Latore. For more, you can go to insead.edu/mission to change.